Welcome to our medical talk. My name is Michaela Rechner and beside me is Dr. Katrin Bieber. Together with her husband, Dr. Meinrad Mills, she founded medical clinic Villa Thal 25 years ago. Our topic today is membrane therapy. How would you explain membrane therapy in general?
Membrane therapy is basically the therapy of our cell structures. We are composed of 70 to 100 trillion cells. And these cells have a cell wall, which is a membrane, and inside the cells, there are 10 times more membrane structures. Also, the mitochondria, which produce our energy, have 2 membranes, and they have to function to be able to produce the energy. So when we look at our ill patients, many suffer from low energy and chronic fatigue and loss of energy. This is exactly the point where we have to start with the membrane therapy. Also, the membrane therapy detoxifies, so we can regenerate the membranes, and at the same time, we detoxify. So what are toxic threats today? We have 3 big areas of toxicity. One is heavy metals. Many have heavy metals in their mouth, either as fillings, tooth fillings, or under the crowns, or in young adults, they have these braces and retainers. Yeah. But also the smokers, they have a lot of heavy metals in the smoke. And heavy metals are found everywhere. Aluminium is associated with Alzheimer's, and aluminium is in the house dust. It's ubiquitous. Another big toxicity is chemicals, like the phthalates, which make plastic soft, or organophosphates, or glyphosate, or all these solvents and diesel exhaust. They also can damage the cell membrane. And then we have mold toxins, which are really toxic. And then we have also damage for the cell membranes from infections. Infections also go through the membrane and damage the membrane. So membrane therapy takes care of all of that.
I see. And why is it important to address cell membranes?
It is important to address the cell membranes. You know, medical society assumes that the cell membrane functions and that it stays healthy. So we see the difference. We see that the cell membranes really suffer from toxic insult and that the cell membrane can be damaged. And what we found the past 30 years is that we can regenerate these damages, and then we heal from cell perspective. We heal from our little compartments to the big organ.
This sounds great to me.
Yes.
Yes. What do cell membranes consist of?
Cell membranes are beautiful structures. They half and half consist of lipids and fats and half of proteins. The lipid half is divided into 3 parts. One part are essential fatty acids, and there you need the right ratio of omega-6 to omega-4 in a 4-to-1 ratio, actually. 1/3 of the lipid compartment is saturated fatty acids. This we can produce quite easily. And 1/3 of the lipid compartment is cholesterol. So cholesterol is really important for the stability and the fluidity of the cell membrane. If we have too much, the cell membrane gets too rigid, that is not good. But if we have too less, the cell membrane gets too fluid, which is not good either. The essential fatty acids, we cannot produce inside of our bodies. So we have to take them in through our nutrition, and with the phospholipid therapy, the membrane therapy, that we can apply in an oral supplementation or also as IV treatment.
So what are the dangers or threats for healthy cell membranes?
The main dangers and threats for the membranes are toxicity. As I said in the beginning, heavy metals, chemicals, molds, and infections, they are the most detrimental threats. But also inflammation, to any extent, makes cell membranes go kaput.
And how do you treat toxic effects on our cell membranes?
With the membrane therapy, we use phospholipids in combination with other different medications. We support the detoxification of our body to get rid of the toxins, and at the same time, we supply the molecules that really heal these damages so we can go back to a really well-functioning and healthy cell membrane. And then all the metabolic steps can function better. The energy production in the mitochondria can get to a normal level again. And this is a prerequisite of healing, actually.
I see. So can we feed our cell membranes then?
Yes, of course we can. We feed the cell membranes right with what we put behind our teeth. And if you get that conscious, and if you do the right choices, you can really support your cell membranes daily with every meal.
This sounds just great to me. Thank you so much, Dr. Bieber.
You're welcome.
If you find this topic interesting and important for your life, feel free to contact us. I'm Michaela Rechner, and I really hope to see you again for interesting upcoming medical talks at Medical Clinic Villa Thal. Thanks.
Bye-bye.